Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest in day-to-day activities. There is also the more severe one termed Major Depressive Disorder or clinical depression. Depression generally affects how you feel, think, and behave, and can lead to a wide variety of emotional, physical, and psychological problems. You may feel powerless when depressed. You aren't alone. Almost everyone have walked through that road. Conquering depression isn't an easy-peasy, at least for a majority of people. This video extensively discusses the 9 most efficient ways to deal with depression. Welcome. Number 1. Manage stress. Practically, stress and depression have a two-way relationship, meaning one affects the other and vice versa. Of course, one can possibly experience one without the other, but there is definitely a viable connection between the two. Not only does stress incite depression, it does prolong and worsen it. In order to conquer depression, figure out all the things in your life that stress you out, such as work overload, financial instabilities, unhealthy relationships, or academic problems, and find possible ways to relieve the coercion and regain clarity and peace. When you experience stress, try to identify your feelings and thoughts and recognize that you would not feel this way forever. To effectively distance yourself from your stress, you must temporarily distract yourself from your current emotions. You may consider stepping away from your current situation. For example, if social media triggers stress, you can consider taking a break for a while. If you are overworking self, you can try to slow down a bit or probably look out for possible ways to relinquish some task to someone else. Doing this would give you some extra time to relax your mind. Number 2. Try to always stay connected and active. It is usual to want to be alone and be by yourself when you are depressed. But the best approach would be to stay connected with people, your friends, family, and loved ones. Being connected helps you to feel safe, supported, and helped. One of the ways that connecting with others can help you is through sharing your experiences. You can unburden yourself and also hear what others have gone through, and they might be kind enough to share with you on how they overcame theirs. Staying active can translate to actively getting involved in your favorite sports. Several studies have revealed that people who participate in sports have somewhat fewer symptoms of depression. Number 3. Set achievable goals. Setting small and achievable goals within a flexible period of time can help to reduce the anxiety you would get from unfinished tasks and unachieved goals. So, instead of compiling a long list of tasks, consider setting small goals. Setting and accomplishing these small and supposedly achievable goals can provide a sense of control, accomplishment, and also help with motivation. So, for example, instead of struggling to read 20 pages of a book every day, you can reduce it to maybe 5 or 10 pages. When you accomplish reading the 5 or 10 pages, you get a sense of satisfaction and accomplishment that in turn slowly drives out any sense of anxiety and sadness. Number 4. Practice guided imagery. Guided imagery is a relaxation technique in which a person intentionally visualizes positive, peaceful, and joyous images or scenarios in their mind. During guided imagery, a person uses all their senses in their imagination to help relax the body and develop a sense of well-being. According to research, guided imagery may be able to positively affect your health and well-being in several ways. Guided imagery helps to reduce anxiety, reduce depression symptoms, and generally helps to improve sleep. Number 5. Avoid or cut down on alcohol and hard drugs. Substances such as hard drugs or alcohol can contribute to perpetuating feelings of sadness and anxiety. On the other hand, people who live and struggle with drugs addiction may experience higher symptoms of depression. In your journey against depression, you may want to consider limiting or maybe totally avoiding the use of alcohol and other addictive substances to help your depressive symptoms. When the substances become addictive, the body becomes more dependent on their effects, resulting in more usage. In this way, depression and substance abuse feed into each other, with one condition often making the other condition worse. Over time, hard substance abuse may not only intensify depressive symptoms, but also eventually lead to dangerous health problems such as brain damage. Number 6. Consult the help of a psychological therapist. Changes in the human body's chemistry can greatly influence mood and thought processes, and biological factors contribute to some cases of depression. In addition, chronic and serious illness such as heart disease or cancer may be accompanied by depression. With many individuals, however, depression signals first and foremost that certain mental and emotional aspects of a person's life are out of balance. Significant transitions and major life stressors, such as the death of a loved one or the loss of a job, can help bring about depression. The causes of depression are not always immediately apparent, so the disorder requires careful evaluation and diagnosis by a trained mental health care professional. Sometimes the circumstances involved in depression are ones over which an individual has little or no control. At other times, however, depression occurs when people are unable to see that they actually have choices and can bring about change in their own lives. There are different types of depression, and each type requires different treatment. Mild depression symptoms may be relieved by learning about the condition, lifestyle changes, such as regular physical exercise, and psychological therapy provided by a mental health professional. For moderate to more severe depression, medical treatments are likely to be required in combination with these other treatments. Psychological treatments, also known as talking therapies, have been found to be an effective way to treat depression. They can help you change your thinking patterns and improve your coping skills so you're better equipped to deal with life's stresses and conflicts. As well as supporting your recovery, psychological therapies can help you stay well by identifying and changing unhelpful thoughts and behavior. There are several different types of psychological treatments that includes cognitive behavior therapy, CBT, interpersonal therapy, IPT, behavior therapy, and mindfulness-based cognitive therapy, MBCT. People with more severe forms of depression, bipolar disorder and psychosis generally need to be treated with medication. This may include one or a combination of mood stabilizers, antipsychotic drugs, and antidepressants. Number 7. Develop healthy habits. Exercise and good sleep can help you keep stress in check. You can also try mindfulness activities that help you focus on the present, like meditation and yoga. Research shows that they can improve the way your brain processes pain and emotions. The truth is, there's no magic diet that will treat depression. But what you put into your belly can have a real and significant effect on the way you feel. Some people also feel better and have more energy when they avoid sugar, preservatives, and processed foods. If you have the means, you consider meeting with a doctor or a professional dietitian for guidance. Number 8. Always stay occupied. Staying occupied with healthy activities or hobbies can be of a help. Staying busy and occupied temporarily distracts your mind from negative thoughts and feelings. In essence, keeping busy doesn't mean avoiding downtime or relaxation. It's about finding a balance between productivity and taking time to rejuvenate. Also remember that staying occupied doesn't mean you would have to do a million things at a time. It is more or less about engaging in activities that aligns with your passion and interest, and it doesn't matter if it's just one thing at a given time. Number 9. Call out for help if you ever get the urge to hurt yourself. Self-harm or self-violence can occur with certain individuals. If you ever get the urge to hurt yourself, please call out for help immediately. You can try calling a friend, family member, loved ones, or an emergency line if possible. Don't withdraw from life. Always remember that people don't pull out of depression. They only become and feel a bit better each day. No matter how hard it gets, always remember that you are bigger than what you are going through. If you believe in the existence of God, then pray to God fervently to help you and give you spiritual guidance. If you find this content helpful, please do not forget to subscribe and share this video with anyone you know is going through depression. Gracias.